Western Cape Premier Alan Winde has wrapped up a visit to farms in Wistenburg. He wanted to see what measures have been put in place to protect staff and assist those who test positive for COVID-19. The province is currently leading the pack with the most infections and deaths. There have also been calls for the province to return to the level 5 lockdown. The Premier joins me for more on this. Good evening, Premier Winde, and thank you so much for your time tonight. Of course, when it comes to what you're seeing on the farms, there has been some concerns coming through from the Eastern Cape provincial officials, in particular around the fact that there may be a lot of people that you're letting out of the province without giving adequate health care.
So, agreed. I had a meeting with the Premier from the Eastern Cape about 2 weeks ago on this specific issue because we have 40,000 people who come from the Eastern Cape to work in the Western Cape. And of course, they come here for a season and then they want to go home again. And so when they want to go home, we must be able to have protocols in place that allow them to go home. And so we've put a protocol together. We've now had a meeting along with our police commissioners from both provinces, Premier and Premier, as well as our transport MECs, and those protocols, and agricultural MECs, and those protocols have now gone through to the Eastern Cape to have a look at. So we have proper testing and triage. And we have it on both sides.
Sure. How much of an impact do you think that's going to make in terms of ensuring that the cross-infection between the provinces is limited?
Well, I mean, the alternative is that people who must then stay in the Western Cape, and for how long must they stay? And of course, they've left their families as part of essential work. They've come across to the Western Cape for work. And now they want to go home. So the idea was to set up a protocol. That protocol involves testing. It involves triage and making sure that we minimize the risk. Understand that, the families, and we must look after these families and make sure, obviously, that they are not transferring the virus, but also that they have the opportunity that when they're finished working, they can go home.
And when it comes to compliance levels, especially on the farms which you were inspecting today, how much compliance is there?
So, I mean, I think in Wistenburg, because it's a hotspot, we've got a program which is the whole of government. So it is from the hospital to the businesses, to the agricultural businesses, to the pack houses, and it is making sure, and to the municipality and town itself. And I think I was impressed with all of the protocols in place. It is about changing times of salary payments, so not all salaries are paid on a Friday, so that you stagger those days so that people can actually have different days in which they end up going to town. Also, some of the industries have now built transferable or trucks that actually take groceries out to rural communities to also slow down and stop transmission. I went to visit the hospital today, had a look at the new beds being put in place, making sure that all of those sectors, the municipality and their role, the retail sector and their role. There is still some work to be done on congregation in the town of Ceres itself, and that's specifically on Fridays and Saturdays. A lot of people were saying that there's still many people congregating, so we've got to have a look at how we're going to get around that with law enforcement, and also more messaging for the public to say this is what we need to, as a responsibility of the public, make sure we're keeping our social distancing, making sure our hygiene practices and our masks, etc., are all being used.
Premier, all that being said, when you look at the rate of infection in the Western Cape, it certainly doesn't suggest that you as officials are doing everything that you need to try and prevent the spread of COVID-19, especially when we look at what's happening in your townships and your informal settlements.
So that's why we've got these hotspots. The hotspot program focuses on the area where we're seeing the growth of the virus more than anywhere else. It's, when you go in and test, you pick up where these hotspots are. These programs are replicated. So it's in Wistenburg, it's in Khayelitsha, it's in the Tygerberg region, it's out in Dunoon. We make sure that we focus on these hotspots to try and slow down the spread of the virus. But our epidemiologists and doctors are saying to us that, we slowed everything down so we can get our health response in place, and we've just got to monitor those hotspots through testing to see that the speed or the transmission doesn't grow beyond doubling every 8 days, which is where we are at the moment, and which our specialists tell us that is probably the speed that it is going to be growing at. It looks like our growth of our virus is probably about a week and a half to 2 weeks ahead, perhaps of some of the other centres in South Africa. But generally that is on track. And of course, if it starts to grow more than doubling every 8 days, then we have to have a look and see what else we need to do to try and slow it down. But really what we've been doing is getting our health response ready, because of course this is going to grow until our projections are that we should be probably having about 80,000 symptomatic cases at the end of June in 1 week.
Sure. And there are questions, though, again, when you look at the rate of infection versus the population size in the Western Cape. There are suggestions that perhaps you're not screening as many people as you need to. Therefore, you're not testing enough people.
But we are definitely testing more people per 100,000 than anywhere else in South Africa. So Gauteng is second to us, and they are starting to pick up more testing. But of course, testing is the next blockage. We've got about 11,000 backlog in testing in the Western Cape. There's about 15,000 backlog in testing in Gauteng. But definitely for the last 4 to 5 weeks, we per 100,000 test more than anywhere else.
And what about screening?
Yes, we do both. So it's the screening and testing. And we must be 350,000 screening and testing now, but that gives us probably about 12,000 of our tests. But it's the targeted, focused testing that goes into our hotspot areas and specifically into where we pick up positives, and the screening around those positives that really gives us the real rate of infection. And of course, the average in South Africa at the moment across screening and direct testing is about 3% to positive, but we were getting, with our focus testing, sometimes up to 7% positive tests coming out, which showed that the targeting was really going to find those specific cases.
One of the biggest problems that you're faced with, of course, is now you also have health workers that today held a protest saying they're not being given the necessary equipment that they need to be able to serve those and take care of those who are suffering from COVID-19.
So, of course, I did take note of that. That happened today in Khayelitsha. I've got a meeting now at 7 where we will be talking about that further. All I do know is that our stock holding of PPE has gone up from 48 million to 102 million in the last month. So I'll just have to go and find out exactly what that means. I know that at one stage we saw that with EMS workers as well, wanting the full white suit PPE. We've developed a new protocol for that. The rest of the EMS use the PPE that gets used in our COVID wards. So I'll go and find out exactly what the detail is. And, of course, the most important thing is that we have PPE for our frontline workers, which are our nurses and our doctors in our healthcare spaces. But I know that the stock holding is growing. I think we've got probably another 250 million rands worth of stock holding on order. But 102 million on stock at the moment.
Sure, but it's no good to have the stock if it's not reaching the people that need it the most. At this point, are you having a conversation that looks at the Western Cape going back to level 5 of the lockdown, given just how dire a state the province seems to be in?
No, I wouldn't say that, because, of course, we've got the hotspots, the 9 hotspots actually across the province, but we've got other parts of our province that have actually gone from 15 cases down to 0 cases. Most of the towns in the Western Cape are below 50 cases, and some of them even below 20 cases now. And so, I mean, definitely not. There are hotspots in the province, yes, and we've got to have a look at how we manage those hotspots. But there are also areas that are actually reducing in numbers in many of our municipalities across the province.